Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to go ahead and summarize the different causes of iron deficiency anemia and what lab markers do we look at when we have different stages of deficiency. I'd like to thank Dr. Karazian for this little PowerPoint chart that he provided, and let's go into detail about what is going on with dietary intake. So, causes and stages of iron deficiency. 1. A diet low in iron. How can that happen? Typically with children, when they're drinking a lot of cow's milk and they're not eating a lot of food. So they're drinking 4, 5, 6 bottles of milk, yet they're not eating much of the nutritious foods, right? Then they can develop iron deficiency. Eating disorders, obviously there's problems with malnutrition, and then countries where they have poor nutrition, right? Growth of tissue. This can occur where iron is being utilized in other areas. So when you have pregnancy and you're feeding the fetus, especially in the 3rd trimester, you can develop iron deficiency. Another is fibroids in women, right? Fibroids will grow with iron, and fibroids is one of those main causes for iron deficiency in women. Obviously, things like cancer, colon cancer can be a factor for iron deficiency absorption. Poor iron absorption, right? How can that happen? Hypochlorhydria, or low stomach acid, or the chronic use of antacids, right? When you use antacids, it's meant to be used for a short period of time. But many people are on antacids for years or sometimes decades. And then that creates an environment where the stomach acid is too low, it does not break down the foods, and it does not absorb your nutrients, including iron, but B12, B9, and other nutrition such as protein, right? So hypochlorhydria is a big problem. H. pylori, or Helicobacter pylori, is a GI infection. It creates an environment that's more basic, and also it creates inflammation. So inflammatory processes, and then H. pylori likes iron. Leaky gut or celiac disease. Now, celiac disease is an autoimmune condition related to gluten. What happens with celiac disease is that it starts to damage the gut lining, and then absorption will be altered. So you have to look out for celiac disease. Parasites, hookworm, pinworms, roundworms, right? These parasitic infections can create an iron deficiency state. Iron loss versus intake. You're taking in enough iron, but you're losing more than you actually take in. And the way that can happen is with GI bleeds or ulcers, right? Or colon cancer, okay? Or abnormal bleeding somewhere that's not detected. So when we look at the different stages of iron deficiency, we look at stage 1. So if we look at the different causes, this kind of correlates with the severity. So from here down, we'll create these types of deficiencies, and it will get worse as we get down into this chart. So stage 1 could be just low iron intake or growth or tissue issues where they're sucking up iron, right? So stage 1, iron deficiency, all you might see is a low ferritin, which is your storage iron. You might have low ferritin, but you have normal iron, iron saturation, a complete blood count, total iron binding capacity, and transferrin. So everything might be normal, but you're going to start to see a low ferritin number, okay? In stage 2, it gets more severe. So you're going to have low ferritin, low iron, and low iron saturation. And then you're going to have an increase in total iron binding capacity, transferrin, but you might still see a normal CBC, things like red blood cell, hemoglobin, hematocrit, etc. As we get more advanced in stage 3, as we discussed in the prior video, you're going to have low hemoglobin, hematocrit, red blood cell, MCV, MCHC, MCH, and then you might see an increase in red cell distribution with a decrease in ferritin, decrease in iron saturation, increase in total iron binding capacity, and increase in transferrin. So what I'd like you to do is basically have this, or a snapshot of this, look at your blood work, and see if you have any of these numbers, right? If you have one of these numbers, you might have low in the first stages. If you have more than one, you might have stage 2 iron deficiency. If you have all of them, you're in stage 3. And it will correlate with this chart right in here, where you have low intake, growth of tissue with fibroids and pregnancy, etc., poor absorption, and then obviously frank bleeds or iron loss due to bleeding, right? This is a great little chart, and I'd like to thank Dr. K for this chart, and I would like you to wait for the next video where we're going to talk about the different ways we can improve iron absorption and what types of iron we can take to improve absorption in the gut. Okay, my name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.